colorectal surgery at Mercy Medical Center and St. Joseph's Hospital. Welcome back to BNC Live, Dr. O'Connor.
Thank you. Thank you, Laverne, for having me.
Thank you for being with us. Let's start by talking about why Black people, especially Black men, are disproportionately affected by this disease.
Well, when you look at colorectal cancer, it is the second most common cause of cancer death in the United States. And when you look at African Americans stage for stage, we are at a greater risk for colorectal cancer and we have a greater mortality. Men and women are, for the most part, equally affected, but Black men are affected more than Black women. And then you have to look at the fact of various factors such as disparity in healthcare, disparity in access, high prevalence risk factors, and there is also a distrust of the medical society. So that can prevent people from getting screening colonoscopies.
And so it is the third most common cancer diagnosed in the U.S. Why exactly then are Black people, they're still not aware of the situation. They're just not aware of certain types of health concerns that they should be. So can you help us through the ways that people can understand how their body and their health can be affected by their genetics?
Well, when you're looking at colorectal cancer, for the most part, 75% of the cancers are diagnosed in patients who have no predisposing risk factors and who have no family history. So it's really about screening, colonoscopies, and it's really about access to care. And the other most important thing is your risk factor prevalence. For instance, diets that are high in fat, high saturated fats, that are the fried foods, the sugary foods, those have higher risk of leading toward colorectal cancer. You're looking for more of a higher fiber diet, more fruits, more vegetables, and you're looking for an active lifestyle. Most times when you're looking at a sedentary lifestyle, that gives you a higher risk for colorectal cancer. And in the African American population, there's a different socioeconomic status issue sometimes, as well as having access to care, as well as being in food deserts where the supermarkets are not easily accessible, the types of foods that are not there, the pricing of certain healthier foods versus lower foods, and also being aware of that, having your medical doctor know that stage for stage, when you look at colorectal cancer, African Americans may have more higher predisposing factors. And it's important also to learn about the symptoms of colorectal cancer. You want to get screened before you have them. But if you start having looser stools, if you have change in bowel habits, you have blood in your stools, you've got abdominal discomfort, you have weight loss, those are the things that we need to look at in terms of signs and symptoms and say, we will need to get screened. So it's important to educate not only yourselves, but as well as your family. And the most important thing also is knowing your family history, whether or not mom had colon cancer, dad had colon cancer, brothers and sisters, your grandparents. It's important to know your family tree, which will arm you with the information that you need to get screened and get screened earlier.
Very, very good information. We appreciate it. We're out of time, Dr. O'Connor, but thank you so much for joining us. We appreciate you being with us here on BNC Live. And stay with us, everyone. We'll be right back after this quick break. You're watching BNC Live.
Closed captioning brought to you by Nutrisystem. Lose weight and get healthy with meals delivered to your door.
Tell me how much weight you lost with Nutrisystem.
I've lost 41 pounds.
45.